My name is Dr. Elizabeth Kimani Murage. I'm a senior research scientist at the African Population and Health Research Center. I lead the Nutrition and Food Systems Unit and the Health and Well-being field, and also the interlinkages with climate change. Food safety is very important because increasingly we are seeing a lot of food being vended from the streets, and that food is often contaminated with chemicals, with microorganisms. It's not safe for human consumption. So it's really important that we are aware of food safety issues, and that we work with the food vendors and the communities to ensure that the food that they are eating, or that the food that is being sold on the streets, is safe. Food safety is actually a part of the right to food, the right to adequate food, which talks about the right to nutritious, safe and acceptable food. So when we need to think, whenever we are thinking about the right to adequate food for everyone, we need to think about the food safety, and often that is left behind. APHRC worked as a facilitator, really bringing the teams together, the different groups that were working on the manual, the University of Nairobi, the county, the city-county of Nairobi, the other stakeholders, the civil society groups, to ensure that this manual is made in a collaborative way, and the different aspects of the manual are the different aspects that are important are included in the manual. Also engaging communities. And we also worked as the research organization, ensuring that we are pre-testing this manual to ensure that the policies that are formed are informed by evidence. The manual is important because, as I mentioned before, nutritious food and safe food is part of the right to food. So having this manual is important because it's really a tool. It's going to be used as a tool to ensure that we are ensuring that the food that is being vended in our streets is safe and nutritious, and working with the vendors, enhancing their awareness on the issue of food safety is important for the actualization of the right to food. Like today, I had one of the vendors representatives talking about that. Really, for that very short time that we implemented the training with the manual, it was very useful for them. They got to know things, they were aware, and it has really helped them change the way they do things. So if we can do this at scale, it's going to have a great impact on the actualization of the right to food from the perspective of food safety, nutritious food, and also healthy food. Yes, we want this manual to be used countrywide, and we will be working with other counties to be able to transfer this manual to those counties, ensuring that we adapt it to those counties. So we'll be going through adaptation process and validation process to ensure that it's relevant to the counties. So, and not to just be for Kenya, but also beyond Kenya in other African countries. So we will be working to see how can this be translated to other settings.